Well, just how safe is the abortion pill? It is a question some are asking after a Texas federal judge suspended the FDA's approval of the most commonly used abortion pill.
While the larger issue appears destined to be decided by the Supreme Court, medical experts say the scientific evidence is quite clear. Our Dr. Frank McGeorge is here to break down the numbers and how they compare to other approved drugs, Doc.
Well, Pam and Devin, in fact, Mifepristone was approved by the FDA in 2000. Now, since then, through June of last year, it's been used by approximately 5.6 million women in the United States to terminate a pregnancy. Now, in France, where it was first approved, it's been in use since 1988, with approvals across the globe through the 1990s, continuing through recent years.
Mifepristone is the first of two drugs used in combination to end a pregnancy. Mifepristone blocks the hormone progesterone, which is necessary to maintain a pregnancy. According to the FDA, since 2000, there have been 5 deaths associated with Mifepristone for every 1 million people in the U.S. who have used the drug. That's a death rate of 0.0005%. By comparison, the risk of death from penicillin, a common antibiotic, is 4 times greater. The risk of death from Viagra, used to treat erectile dysfunction, is nearly 10 times greater. Of course, pregnancy and childbirth carry certain risks to the mother. According to the CDC, the maternal death rate for 2021, the year for which the most recent data is available, was 32.9 deaths per 100,000 live births. That's dramatically higher than the 5 deaths per million for Mifepristone. The FDA says potential side effects of Mifepristone include dizziness, weakness, vomiting, headache, diarrhea, nausea, fever, and chills. More serious side effects include blood loss, hospitalization, or a significant infection. Those happen in less than 0.3% of patients.
Now, Mifepristone should not be used in the case of an ectopic pregnancy or tubal pregnancy. A lack of adequate screening for that contraindication is actually cited in the court documents by the plaintiffs. Now, the FDA has confirmed 2 fatal cases of ruptured ectopic pregnancies among the 5.6 million usages.
So death, obviously, the most severe complication, but what do we know about the data on other serious complications that aren't death?
Well, since the approval in 2000, actually, there have been 1,048 hospitalizations reported. Now, many of those were related to infection and bleeding. But I should point out, there was actually a change in 2016 in the reporting requirements for hospitalizations as well as severe events. So the hospitalization data cannot be compared across all the years since its approval, just like the deaths. It's a little bit different. But basically, it is very safe.
Seems so. Yeah. All right, Doc.